I'm Lenny Santacola with WorkSpan TV. I had the opportunity to sit down with Bob Sanders and Tom Sondergeld and discuss with them their success in building on-site workplace clinics. Both Bob and Tom shared with us how they went about building the business case, how they measured the effectiveness of their on-site clinics, such as return on investment, and gave some practical advice to practitioners who might be thinking of going down this path.
We wanted to practice what we preach. We are a health insurance company, and our idea was that we want our members to be healthy, we want to promote wellness, and the best way to go about promoting wellness is to have an on-site clinic where we actually have people come in, have employees come in and get immediate care.
Today we offer a full suite of primary care services. We have a physician and a nurse practitioner on site, and so they offer a full spectrum of primary care services, and they can actually function as a primary care provider if a team member were to choose to do that. We also offer a whole host of wellness services, dietary consulting. We have a fitness center that offers fitness consulting and fitness testing, as well as fitness coaching. And then we are going to be adding telemedicine to the service, and we're also going to be adding some services around physical therapy and occupational therapy.
We have an outside company called Centene Corporation run our clinic, and they are the ones who hire and have a consulting agreement with the different individuals who are working in the clinic. Our medical director is there for 24 hours a week, and then we have 2 nurse practitioners that will also work to cover the 55-hour span that we are open during the week. In addition to that, we have 2 medical assistants that split the time so that we basically always have either a medical doctor or a physician assistant or both on hand.
We actually have 2 clinics. One's in a distribution center. That was the first one we opened about 3 years ago. That communication happened over a long span of time in team meetings that we had on site before the opening of the center and what the intention of the center would be. We had to come back a year later and refit the design of that center because it wasn't quite fitting the culture, and we re-announced it with a grand opening and had several team meetings at the same time with that one. In Deerfield, different situation because it's our corporate headquarters. We had a number of communications that went out in advance. It was part of a strategy to move our senior executives from one building to the same building we were going to co-locate the health center in. So it was a big campus move that initiated the communication. And then on the opening day, our senior executives, including our CEO, spoke in a teleconference via across the network to all 250,000 employees when we opened that center about expectations and that the center would be opened. Usage has just been phenomenal. The Deerfield Center, we see about a 30% utilization, which is great for a corporate campus. And then Mount Vernon Distribution Center, much harder population to reach. We're seeing about a 26% utilization now that we fixed some of the issues we had with the center in the first place, with 13% originally.
There's definitely a return on investment, but you have to look at both the hard dollars and the soft dollars. And by hard dollars, I mean the productivity that you may see increased, the fact that people are not absent from work as long. As an example, we on average believe that an employee who has a physician visit outside, who goes to their primary care physician or their specialist, is probably going to be gone 1.5 to 2 hours. In our situation, they have 5 minutes to walk over to the clinic. We believe strongly that there should be no waiting period. So they get over there, maybe they wait 5 minutes, they're gone 30 minutes, they're back at their desk. So from that perspective, we measure the soft dollars. In addition, we have third-party companies within our building who participate, who pay us a monthly stipend and have their employees come and participate also. So our return on investment, as we've measured it in the first year, has been around 1.78 to 1 for the cost of the clinic.
We're in a similar situation, however, we measure across 3 different components. We measure the cost avoidance to the health plan, the actual hard dollar, as Bob put it, savings to the plan in both ER visit avoidance that can be measured, claims avoidance, that because it's being managed in the health center rather than the more expensive community, that claims avoidance, and then referral avoidance or referral management, as we call it. That's one component, the hard dollar or the cost avoidance to the medical plan. Then we look at productivity savings and we look at absenteeism, and those are more the soft approaches. We look at them in two different strata because we tend to believe that productivity has a greater weight for us and absenteeism is much more challenging to measure, and we put it all in a data warehouse and compare it to true claims out in the workforce, and we can do cohort analysis as well.
It's important that you be able to look at both hard dollars and soft dollar savings. That if you just look at the cost of the clinic, you're not going to see enough return to justify the expenditure. I also will comment that you need to have at least, in my opinion, 1,000 employees or 1,000 who are eligible to participate. That's kind of the break even. Anything below that, and it's not cost effective to do that. At the same time, I think it's important that you continue to manage the program, that once it's in place that you make sure you come up with a model that's flexible so that if you need to increase the physician hours or you need to increase the physician assistant number hours, that you're in that position, because if utilization does increase, as Tom mentioned, we may be in a situation where you have overutilization and you have people waiting. We've found in the past year or so that our wait time became from 5 to 15 minutes in some cases during busy times of the day, and we had to adjust and make sure that we, for example, added more medical assistance to certain parts of the day so that we had double coverage, if you will.
If you're considering clinic for the first time, I think you have to first analyze your workforce. See what they want. I think the answer for an on-site has to match with what the workforce is asking for, not something you design and hope the workforce comes to. That's one. The second most important feature is you have to get senior management support. You have to find out what senior management want measured, and you have to find out what's key to senior management, including your CFO, who want to see the numbers and want to see the ROI return. They have to understand that and buy into that. Third, I think as you're getting closer to consideration, I think you have to seriously integrate across all that you can, and that means that you have to bring to bear all the resources that you have in medical, dental, vision, EAP, any solution that you have under your plans, bring them together with the on-site so that solution is permeated across a whole spectrum of services rather than just in a pillar through the on-site services.
It's important that you celebrate successes,
yes,
that you make sure that you advertise the clinic. When we first opened it, there was not the awareness that we needed, and people weren't there knowing that they could run over there rather than run to their PCP, or they could have a child get a sports physical or a regular physical at the clinic. Celebrate successes, meaning, for example, we had a situation in the past 2 years where we've had 3 patients who we were able to find melanoma. And the quality issues that go around that, just not even to begin with the cost of it being less, but the quality of life and the issues that we found from that, that's a huge, it's just a big sales point for something like this.
And to wrap, communication, communication, communication. Don't stop. Because a lot like wellness, wellness is a thing that people need at one moment in time. Somebody may not need your clinic today, but they may need it tomorrow, and if you're not out there communicating, they'll miss the opportunity.